So in this little group, we're going to have a bit more exploration around the case study that Charles has just told us about. And this is an opportunity for everyone to add into discussion. So please do join in. You can use your reactions button on the Zoom control panel if you want to make a comment or give us a wave. So we're not going to do full introductions. If you'd like to say where you're coming from, that's fine when you make a contribution. But hopefully now, Mark and Charles, have you got anything else that you'd like to tell us? You whiz through the case study there that you can kind of get us started with, and then we can take some questions.
Nothing from my point of view. I guess, you know, whilst we use a range of examples, I mean, there's an awful lot going on, and I've no doubt that there'll be loads, if not better, case studies from yourselves as well about what you've done as authorities or organisations.
Has anybody got any particular questions to get us going? Hello. Lorna, I can't hear you.
I'd put the mute on my headset as well.
Yay.
Double protect. Hi there. I'm Lorna Peacock. I'm from Locala Community Health Organisation. I suppose the first question is, have you been working with any of my colleagues at all in this area? Because this is something we're quite keen on looking at from a service perspective, and also from our social value as a community interest company perspective. So it's understanding how you are working with the system currently.
Some of the work that I've done with adults, I know that Locala have got a partnership in some of our care homes, so they'll have indirectly been involved in perhaps some of the outcomes. There's at least 2 of them. I'm not sure if there's probably more, but I can think of. We also work quite closely with the single point of contact, SPOC. But I'm just trying to think if there's been any particular link up on these projects. I know that we probably will have been within adults, because there's, you know, we sort of play part of a game in it, if you like.
Yeah, I mean, I would be interested. It might not be the time now because it would just dominate the whole breakout session, but if I could get your contact details, I'd really like to have a conversation. So we obviously have our community healthcare services, which we can look at how we can work in partnership with you on, but also through our social value work, we're working closely with the voluntary community sector, the primary care network anchor organisations. And one of the key things that has come up is digital exclusion, and how that can support our communities in so many different ways, such as social isolation, around health, around finance, around young families with children being off school. So there's I think the loaning scheme and how we can invest in that community so it's a joined up thing would be fantastic.
Yeah, I've just put my email address on the chat. So.
Lorna, where are you from? What does your organisation do?
So we're the community healthcare provider in Kirklees. Also, we deliver some services in Bradford and Calderdale as well.
Right.
So it's great. I suppose the last thing you want to do is just go and do something, and it's about duplication. Like Charles was saying in his presentation, it's about that system approach and how we can join that up and add value in those areas. And I think some of the presentations earlier on, taking some of that learning as well and how we can look at doing that in Kirklees would be great.
I think it's definitely a case of, from a Kirklees perspective, a lot of it initially was knee-jerk. It was, you know, we're able to respond quite quickly to people's needs, and but now when I sort of talk about the ones going forward, we're able to sort of reflect on those and say, well, we need to do things better. We need to establish those working groups with, you know, health or, you know, the other sectors.
No, it's great. I mean,
really
I think
important.
It's great, and being able to tap into what you're doing, that's brilliant. You're the experts in that, and we can bring the health side to it. So yeah, it'd be really good.
We're sort of saying it's linking up, it's partnership, it's gluing it all together and not working independently and reinventing the wheel.
Yeah, where we can avoid that, absolutely.
Okay.
And I think that's where we're just about to embark on this partnership, which, you know, it's something that Charles hasn't said, and I don't want to sort of dilute anything because it was all really, but you know, we looked at this purely from an IT perspective to start with. It was like the technology, how can we change the way it was as much about our service as anything, and then it's sort of escalated, and we've now got to the partnership stage where we've got lots of different people involved, but it really is just at the outset of that. In fact, I'm expecting some terms of reference this afternoon about, and there will be people from adults and health and things like that.
Right.
And I suppose that's, we can actually, Charles and myself can introduce the Locala part of that as well there, because it's more or less sometimes we're doing the technology part, but we're not actually familiar with everybody that could be involved.
Oh, yeah.
So we don't even know what that group should look like, but absolutely.
Yeah, if we could have
yeah.
If we could, I'll send you my email now as well, so you've got
Yes,
that. But
please.
yeah, if we could have representation there, that would be brilliant.
Yeah. Thank you. Yeah.
So in terms of your presentation, Charles, you were saying that you'd bought a lot of equipment. What was the kind of, where did the funding come from that, and what kind of cost? Oh, can't hear you.
Sorry. It was various different strands, really. I mean, obviously, the bulk of it, like the DFE laptops, were a government incentive, so that took care of over 2,500 or something like that. Facebook portals were provided by Facebook via Edge UK, and the rest of it were a combination of where we'd got funding within IT, or we felt like we should make a difference. I mean, you know, it's been some roundabouts. You know, within the council, we've printed next to nothing, and our print budget's gone down, so we've had a little bit of capital. We've been able to sort of invest in different areas.
Okay.
But it's just using that little bit. There's also ones coming forward, like for example, job seekers. I know there's a grant fund that we're going to get 65 Chrome devices. And again, it's just different pots, really. There's been some COVID response money as well that we've been able to tap into for different areas within the care homes. And that was particularly around doing things, you know, for example, linking into some of the events in the town hall that they're playing the organ. But it just broadens people's day, really, makes them a bit happier.
So you've kind of, been dipping into lots of little pots and making those Age UK with the Facebook. That's helping you. Get everyone connected. The print budget's interesting, isn't it? That's
same as the app as well that was developed for the befriending app. That was TechForce 19 bid. I think it was I can't remember, it might have been about 20,000 was available to develop that. And I think that was something that came about pre-COVID, strangely enough. It was about befriending, and post-COVID, it was, you know, as soon as it kicked off, we were able to sort of take that and morph it slightly to hit a niche that had clearly come up as part of COVID-19.
And do you think that would gain even more funding now that it's almost proved its worth?
Possibly. To be fair, we probably are in the stage now of going back and speaking to them and speaking to Age UK about, you know, the success of it. I know the early doors, they were really positive about it. But I guess there's some of this, it's like, because it's all been rush. with COVID, and even now I was saying to our head of service, you know, we might be coming into another lockdown.
Yeah.
What I would give to do what we did after the first lockdown before it, you know, there's things I want to do now, you know, which I think can make a difference to people's lives. But it's maybe taking time to reflect on what has gone well and some of the mistakes, you know, because that's what you learn from.
I'm rapidly trying to make scribbled notes here. What's gone well and what you can learn from. We had a 5-minute warning a couple of minutes ago. I don't know if you all saw that, but not long. It's all going so quickly.
Yeah, it is.
Trying to see the notes I made. So in terms of, say, taking things into care homes, how did that work with the reluctance maybe of people, or, you know, one of the speakers was saying that softly approach of getting a jigsaw onto an iPad. How did that all work?
There were. It's amazing how many of the staff were quite positive in using the technology. So within most of the settings, you get some members of staff that are a little bit more technology au fait. And to some extent, some of the devices what you use at home as well. So, you know, tablets and things like that. We might need a bit of help sort of getting them working on Wi-Fi, but once they're up and running with that they're away.
So it's more of a
it
screen
didn't go
than a
too
keyboard.
bad.
Yeah.
I mean, it was like some of the other things we did. You know, we did safeguarding inspections where we couldn't go into homes. We provided the staff with 4G tablets, so again, we could set it up and leave it on the door. Someone takes it in and are able to do the safeguard inspections on the go. There's just lots of different ways of using the technology.
So that was like a 4G tablet. And they were doing what? Safeguarding and assessment using that?
Yeah, if it was a safeguarding risk, we have a duty as care as an authority to respond to that and investigate it. And whilst we're not allowed on the premise, because obviously, you know, people are isolating and it was too great a risk, we were able to sort of give them the device. It was all wiped down and then we could take it in and move it around, and we were able to ask questions on the go.
Right. And staff just generally, it seems from what you're saying, were enthusiastic about you.
Yeah,
kind of going
I mean,
in.
a lot of some of the comments I put on the second slide were from, you know, some of the people, even dementia. You know, there's a gentleman who was he got dementia and he was able to get hold of a tablet and just start scrolling through it, and the staff were amazed. And it turns out he used to have a tablet some years ago when we spoke to his wife, but no idea. You know, there's just so many good news stories that came out from the people that used it or the staff. You know, the lady was crying because she was able to do the e-book. She didn't realize how easy it was.
So it's just that really, well, I say simple technology, but a thing that looks like a screen rather than a keyboard or a phone or whatever. They're just, we've got a sign up here. Have you got that on your screens that we need to leave?
Yes.
Sorry, I'm having to cut this short. There's so much to talk about.
It's all right.
All right, I'll see you back in the main room. Thank you.
Thank
Bye-bye.
you.